Thank you, Mr. Chairman, and I thank the witnesses for useful testimony. Much of the discussion today has dealt with safety. I'd like to, however, follow on the more recent questions having to do with nutritional value and standards and the access to other foods in the schools. It happens that last night I was in my office in New Jersey about 7:30 in the evening, and a young man, a middle school student from Freehold, Ryan Lerner, called and said, "What can we do about obesity in all my friends?" And his father then got on the line and apologized for the son calling the congressman. And I praised the young man for his concern. He wanted to know whether it was just a matter of physical education and exercise. And I said, well, that, but also nutrition. And it is, I think, pretty well established now that school meals are too high in fat and sodium. They are not as nutritious as we need. There's not as much fruit and vegetable as we would like to see. And except in a handful of states that have restricted the other a la carte and competitive foods and vending machines and so forth in the schools, there are too many other opportunities for bad eating habits. So it's an open-ended question, I suppose, mostly to Ms. Hill and Ms. Corrigan, but to any of you. What can we do about this? I would like to be able to tell young Mr. Lerner
we'll talk to him.
that things are getting better.
And they are.
In the time while he is still in school.
They are. And let me say that many of our school districts across this country understand the obesity problem, and we understand the role that we play. It is not totally our responsibility, as you've mentioned, but certainly we have a very critical role that we must play. And I think you will see across this country that more and more our programs are offering the healthier foods. You will see more fresh fruits and fresh vegetables. You will see those entree items that are lower in the percentage of fat and sodium. And that's one of the pieces that we're talking about.
But it seems so voluntary and so slow.
Well,
some states have taken stronger action.
That is correct.
Should we be taking stronger action?
That's why we're asking for that national nutrition standard that would basically work towards that, and all of us would be working towards a common goal. Everybody would be on the same page. Even in some states, you'll find some are higher than others. And let me just say initially, to start with, USDA guidelines that we operate the programs on do give us some requirements of how we're operating those programs. And there is, as Dora mentioned earlier, a certain percentage of fat and those kinds of things that we really need to look at when we plan our menus. With the wellness plans, and I think that was the item that opened the door with all of these different nutrition standards across this country, was because they really wanted to work on the dietary guidelines and to see what role and how they could really be instrumental in reducing the obesity rate. The point is, though, we all want to be on the same page. We want those standards that really would affect all school districts, all students, because they're basically the same. Like your young man, the same applies to him as it does for any other child in any other state. And what we're saying is, let's get some uniformity, give the Secretary that responsibility to get some uniformity in those standards, because it is a constant issue that we will be working on. We know our responsibility, but I think you'll see a tremendous change in our programs, even in the foods.
Ms. Corrigan also,
okay.
Please. Thank you.
Thank you. I'd like to add to Ms. Hill's comments, because in our school district, we started many years ago to try and create menus that were healthier for kids. And the way we did that is we looked at what students' favorite menu options were, and then we took those and tried to create a healthier alternative. You know, if you were to see, you will occasionally see nachos on our menu, and people will think, nachos? Why are they serving kids nachos? Well, it's a low-fat, low-sodium, high-fiber chip. The cheese sauce is the same. probably not high fiber, but low fat and low sodium. And we do offer it with fresh fruit, fresh vegetable, salads. We try and include a lot of seasonal produce. So we have things like strawberries and kiwi and pears, fresh pears on our menus. And so I would encourage your student who called you to really go in and find out the truth on the menus at school. I can't speak for the district he's in, but a lot of times we've tried to do this over years in sort of a tricky way. We don't necessarily want the kids to know it's healthy. But the unfortunate part is that then the parents may not know either. So in our school district, we have nutrient analysis on the menu, so now the parents can see that all of our meals do, day after day, meet the dietary guidelines for Americans. So the perception might not be accurate, so I would encourage the student to really find out the details.
Well, you don't have to look far to see the effect on the body weight of kids. Thank you, Mr. Chairman.
Thank you very much. Let me just conclude by